Good afternoon. My name is Andrew Villarreal. This is PowerPoint on core determinants of health. Employment and working conditions both impact mental and physical health. Time spent at work influences level of stress, social, mental, and physical health. Poor working conditions and employment conditions leads to chronic diseases, injuries, ill health, and mortality. ODPHP 2022. Education and literacy. Literacy and education helps transcend low economic and social circumstances. Educated get better jobs, higher pay, and improved standards of living and health. ODPHP 2022. Health services. Use and access to services can promote good health and prevent infection. Measures like clean water supplies result in good health. Omana 2021. Physical environment. Physical environments factors like air pollutants and harmful substances impact health. Proximity to toxic areas, unhealthy living standards, and unhealthy foods are associated with bad health. This is unlike for people living in places with good quality infrastructure and recreational facilities. ODPHP 2022. Social support networks, including friends and family, is associated with low stress and depression, unlike when a person is isolated or lonely. Physical environments. Physical environments factor the impact of health include air pollution and harmful substances, proximity, closeness to toxic area sites, access to health-related resources, unhealthy or healthy foods, recreational resources, medical care, community design or built environments like transportation systems and street connectivity. Better infrastructure allows walking, easy transportation, and access to quality healthcare. Social support networks. Social support and strong relationships are linked to strong physiological health achieved through a network of friends and family. Poor social support leads to loneliness and depression, suicide, cardiovascular disease, and alcohol use. Types of social support include emotional support, informational support, and instrumental support, etc. Cherry 2022. Personal health practices and coping skills, social environments. Personal health practices and coping skills like self-care, individual choices on hygiene and diet or eating habits, smoking and drinking can determine the health of an individual. Additionally, the social environment, including the groups we belong to, our neighborhoods, working conditions, and workplaces, and policies influence our behavior, living standards, and health. ODPHP 2022. Healthy child development and biology and genetic endowment. Healthy child development impacts physical and mental health outcomes later in life. Healthy development and growth needs family-centered, culturally competent, and community-based coordinated support and care during childhood influences later behavior and health. Ministries of Health and Long-Term Care 2018. It impacts school successes, social well-being, and economic participation. Biology and genetic endowment. Similarly, organic makeup and basic biology of the human body influence health. Genetic inheritance predisposes people to certain responses towards disease causing microorganisms and their lifetime health. Culture. Cultural background influences one's behavior, beliefs, attitudes to disease or illnesses, misfortune and pain, body image, diet, language, emotions, and perception. Sabato 2018. Financial and social status. Social status and higher income can improve health. The more affluent people, the better access to better healthcare services they will have and live healthier than most impoverished ones. Sabato 2018. Gender. Gender is how society ascribes to the male and female sexes. Gender norms impact health systems, priorities, and practices. Gender inequities result in income disparities and differential access to good quality health services, unequal obligations to offer unpaid family health care duties, unequal nutrition. Byhoff, 2019. Impact of health service use and access on diabetic patients. Assessing high use population concerning healthcare service can help create targeted interventions for people with comorbidities. Omana 2021. Poor healthcare utilization and knowledge about diabetes is linked to worse health results in diabetic patients. Poor healthcare utilization and knowledge also results in increasing burden of the disease. Poor knowledge of the disease and healthcare utilization is associated with the worst health outcomes, leading to increased burden of diabetes. CITIQ 2017. And these are the references that were used for the presentation.